Somewhere in your 40s, something starts to feel different. You're eating the same but gaining weight. You're more tired even after a full night's sleep. And your body just doesn't respond the way it used to. And the frustrating part, no one really talks about what to expect in your 40s or explain why this is happening. No one, not your mom, your aunt, or your elder siblings, and not even your doctor. Hi, I'm Dr. Bazgha Khalid, and I see this every day in my primary care and weight loss clinic. My patients, especially women, doing everything right, but feeling like they're losing control of their own bodies. So in this video, I'm going to walk you through what actually changes after 40, from hormones to metabolism to muscle, and more importantly, what we can do about it. First, let me ask you something. Have you looked at yourself recently and thought, when did this change happen? It could be your weight, your energy, your skin, your sleep. Let me know in the comments below. So let's break down what happens in our body after 40. Think of your body like a system that's been running for decades. Around 40s, a few key things start shifting. Number one, muscle loss. You start losing muscle slowly. This is called sarcopenia. Muscle loss or sarcopenia can start as early as in our 30s in both men and women. After 40, the decline becomes more noticeable, and it accelerates further after 50s and 60s. With age, we lose muscle mass, strength, and power, making daily activities feel harder. This also slows down metabolism, making weight gain easier and fat loss more difficult. Less muscle equals fewer calories burned. Even if you eat the same, you gain weight because you have less muscle and slower metabolic rate. There is research showing that as we age, we naturally lose muscle fibers and strength, starting around late 30s to 40s, and then becoming significant as the time goes by. This loss of muscle fiber and strength happens partly due to the loss of nerve supply to the muscles. The second significant change starting around 40s is hormone shift. Hormone starts to shift. For women, estrogen begins to fluctuate and perimenopause starts. For men, gradual decline in testosterone levels happen. These hormone shifts affect fat distribution, mood, and energy. There are clinical studies that show that weight gain during perimenopause and menopause is not mainly due to the menopause itself, but due to aging. However, hormonal changes, especially low estrogen, leads to increase in body fat and more fat storage around the belly. This shift towards central obesity or belly fat raises risk for metabolic and heart disease. Third big change that happens around 40s is insulin resistance increases. Our bodies become less efficient at handling sugar, so it produces more insulin, and insulin promotes fat storage. There are studies showing that aging is associated with an increase in insulin resistance, but much of this is driven by changes like higher body fat and lower physical activity rather than age alone. Insulin secretion may decline slightly with age, but in healthy individuals, the pancreas often compensates to maintain normal blood sugar. Overall, lifestyle factors play a major role in whether age-related changes lead to impaired glucose tolerance, insulin resistance, or diabetes. The fourth big change that happens in our 40s is recovery slows down. This means that you don't bounce back like before. Workouts feel harder. Injuries last longer and fatigue builds up. So biologically, things are changing. In your 40s, the metabolism gradually slows, hormones begin to shift, and insulin resistance can increase, making it easier to gain fat, especially around the abdomen. At the same time, slower recovery and muscle loss can reduce energy, strength, and metabolic health, increasing the risk for weight gain and conditions like diabetes and heart disease. But here's the part most people miss. It's not just the number 40, it's how we live. Let me explain. Look at our life today. More stress, less sleep, more processed food, and less movement. All of this increases cortisol, the stress hormone. And cortisol does three things. It increases belly fat, increases cravings, and disrupts sleep. So now you're dealing with biological effects of age and lifestyle combined. And that's why it feels so hard. So how do biological changes with age and lifestyle affect our body? Let's look at what changes show up in real life. Number one, weight. Most of us notice more belly fat and it becomes really hard to lose weight. Number two, energy. Most of us experience constant fatigue and afternoon crashes. Number three, skin. Our skin becomes less elastic, has less collagen, and more dryness. Number four, sleep. Most people notice lighter sleep, poor sleep quality, and waking up tired becomes a new normal. Number five, mood. Mood changes like irritability and low motivation are fairly common. And when all of this happens all together, it feels overwhelming. The most common complaint that I hear in my primary care and weight management clinic is weight gain and fatigue. Let me know in the comments if you have noticed any of these changes or any other changes in your 40s and later. Now, with all of this going on at cellular and biological level, leading to noticeable changes in your appearance, health, and mood, it is easy to become overwhelmed. And most people at this point think, I just need to try harder. So they eat less, exercise more, and push harder. But that often backfires because our body is already stressed. So what happens? Burnout, cravings, plateaus. The problem is not effort, it's the wrong strategy for this stage of our life. So what actually works after 40? Here are some simple and practical tips to optimize your health. Number one, prioritize protein. Eat protein with every meal. Protein helps muscle, protein helps you feel full, and protein supports metabolism. Number two, strength training. 2 to 3 times per week, strength training is the most powerful tool after 40. Start slow, learn good technique, and then continue to challenge your body with progressive overload. If you are new to this, working with a personal trainer can help. Number three, walk daily. Daily walks, especially after meals, are very helpful. Walk helps blood sugar and improves energy. Number four, fix your sleep. Restful, quality 8 hours of sleep is essential for our body. It's like charging our body. And if sleep is off, nothing else that I mentioned about works well. Number five, manage stress. It's hard to eliminate stress completely, but try to reduce the impact of stress by small changes and things like relaxation breathing, short breaks, and stepping away from triggers. Number six, check your health markers. Don't assume that all of your symptoms are due to your 4th decade of life. Sometimes you need labs to check for things like thyroid, glucose, cholesterol, and blood count, to name a few. Because sometimes it's not just age or lifestyle. Here's the big picture reflection. After 40, your body is not broken, it's just different. And once you understand that, you stop fighting your body and you start working with it. And that changes everything. Let me know in the comments what has changed the most for you after 40. Is it weight, energy, sleep, or what changes did you make to help your health? If this video made you feel understood, that's exactly why I made this video, because you're not alone in this. In my upcoming videos, I'll keep talking about topics that affect our metabolic health and how to take control of our own health. And that conversation can completely change your approach to health and weight loss. So make sure you're subscribed, share this video with a loved one who will benefit from this conversation. Stay happy, stay healthy and well, and I'll see you in the next one. Bye for now.